elections collected over here in Nellai, and we have been having lots of public-private partnership with collectors. And to start with this program, Nellai Cancer Care Center has been a very unique organization by Udo Mulakal, and we have been doing a lot of activities focusing on preventive oncology for the last 10 years now. From 2022 to 2011 to 2022, we have created awareness among 150,000 people, and we also have reached out to over 45,000 people in screening. And every year we used to screen around 6,000 people, especially from the lower strata of people who are less privileged. And in this process, we have been able to reach out to a lot of initiatives. And our benchmark programs, community-based care and support for cancer patients. And we have been engaged in preventive oncology, especially in creating awareness. We have positive speakers over here who are going to share their experiences. And we have our wonderful people who have engaged in a lot of screening. And each of our doctors have been screened over 25,000 people over here. And to start with, I request Hari to formally welcome the gathering, please. Mr. Hari?
Thank you.
Yeah.
Thank you, Ramkumar sir. So, on behalf of AstraZeneca, I welcome the District Collector, Tirunelveli, Corporation Commissioner, Deputy Director of Public Health, Dean, Tirunelveli Medical College, on behalf of AstraZeneca, to launch the cancer awareness and screening campaign. I understand from Ramkumar sir and Shankar sir, the Nellai Cancer Care Center, in collaboration with Udo Mulakal, has made a significant contribution to cancer awareness and screening programs during the last 10 years. Today, AstraZeneca India, in collaboration with Nellai Cancer Care Center and Udo Mulakal, is expanding the cancer screening and awareness program to the southern part of Tamil Nadu. On behalf of AstraZeneca, I welcome Prad and also Shiva and other leaders as part of this call. And thank you and welcome all to be part of this event.
Thank you so much, Mr. Hari. And to start with our program, we have a cancer survivor who is over here, and I would request Ms. Arunachalam to share her experience.
Is there audible from there?
Tamil, yes, sir. Hari, can you see us?
No, we are not able to see. We are able to see the.
Fine. I mean, we also don't want her to be exposed because it. So, I'm in the pace lama.
It's not audible, Ramkumar sir. Maybe she has to come near the mic.
Is it audible now?
No, it is low. It is low.
Morning inside.
எனக்கு கேன்சர் நோய் வந்து 8 வருஷம் ஆகுது. நான் திருவனந்தபுரத்தில் தான் ட்ரீட்மெண்ட் எடுத்துக்கிட்டு இருந்தேன். அப்புறம் வசதி இல்லாதனால நான் மெடிசன் 7 மாதம் சாப்பிடலை. அப்புறம் நான் கடையில் ஒர்க் பண்ணுறதுனால என் கடையில் வந்து ஒரு கஸ்டமர் வந்து சொன்னாங்க, இந்த நெல்லை கேன்சர் சென்டரில் ஒரு மேடம் இருக்கிறதுனால அவங்க வந்து சொன்னாங்க, அவங்க வந்து நான் மெடிசன் சாப்பிடலைன்னு சொன்னேன். அவங்க வந்து இந்த மாதிரி நெல்லை கேன்சர் சென்டர் இருக்குது, அதில் வந்து உங்களை நான் இது பண்ணி விடுதேன், நீங்கள் அங்கே போய் பாருங்கள் அப்படின்னாங்க. நான் அங்கே போய் பார்த்தேன். அவங்க நல்லபடியாக நான் இந்த மாதிரி மெடிசன் வாங்கி தரேன், நீங்கள் சாப்பிடுங்க அப்படின்னாங்க. இப்போ நான் அங்கே தான் 5 மாதமாக இப்போ 5 வருஷமாக இப்போ அங்கே தான் சாப்பிட்டுட்ருக்கேன். நல்லபடியாக பார்த்துக்கிட்டு தாங்க. ஆனால் நல்லா இப்போ அங்கே தான் மாதம் மாதம் மெடிசன் வாங்கி தராங்க, நான் சாப்பிட்டுட்ருக்கேன். அவங்க தான் என்னையும் என் பிள்ளைகளையும் அவங்க தான் காப்பாற்றியிருக்காங்க. அதுதான் நான் நன்றி சொல்லணும்.
Thank you. Arunachalam வந்து பார்த்தீங்கன்னா, she is always a very positive lady, and she is taking treatment from RCC Trivandrum for leukemia, and we have been offering her free medicines, Imitab, for over last 2 to 3 years now, and we have subsidized the medicine from 5,000 rupees to 700 rupees, which we are getting it, and we have been doing. And I also have to acknowledge here, I request our palliative team to get up. Palliative team, we have our palliative team who have been providing community home-based care services at the doorstep of cancer patients. To share one XP of positive note, from the surgical department of our Nellai Medical College Hospital, we had the HOD Dr. Sundaram requesting us to follow up some of the surgical patients who have undergone surgery. Because they were not coming back, we were asked to follow them up. 86 patients, we ensured 80% of them going back to the hospital with home-based care services, and also give them a big round of applause. You might not be able to see our team, but they are the backbones who are providing the best of the services. Thank you. Since Dean sir could not participate, he's held up in a COVID meeting, he could not have come over here. We'll straight away get into the process, and I would request our collector to formally launch this program, formally inaugurate this event. Thank you so much, sir.
A very warm at the outset, let me congratulate and thank AstraZeneca and Nellai Cancer Care and the Blood Bank for coming forward to this probably the most important health mission in the coming decade, I would say. Because now we are coming out of almost 2 years of COVID. Hopefully we won't be hitting a fourth wave, and we will pass off with a mild COVID case. But then in the last 2 years, what we have noticed is the number of NCD cases that have been kind of due to surge in COVID cases. We have not looked at the cardiac cases for the last 2 years. We have not been able to do justice to cancer patients. We have not been able to do justice to the entire spectrum of NCD diseases. Partly because the entire health system, the primary, secondary, and the tertiary care sector was fully focused on the COVID-19 pandemic. On that note, I would also like to inform you that Nellai Medical College, which is one of the main regional cancer centers in this part of the state, is looking forward to expand its cancer care facilities, and Tamil Nadu has embarked on the National Pain and Palliative Mission under the National Health Mission, but we are yet to make it a community-based model yet. We still have a good tertiary care facility, but if you look at community-based pain and palliative care, I think we've got a long way to go. Shortly, we are planning to organize a national level workshop at Nellai Medical College on the best practices and models available in pain and palliative care, with a focus in the southern part of the state. On that note, I would extend my arm to both AstraZeneca as well as Nellai Cancer Care Center to be part of the upcoming workshop, which will be organized by the Regional Cancer Care Center at Nellai Medical College. I wish all the very best to the team. Pain and palliative care is a very, very committed and, more importantly, a very passionate process. You might have, it's not about skill, it's not about expertise, it's more about compassion for fellow human beings, and that's the hallmark which defines a quality community-based palliative and pain model. I'm sure Tamil Nadu will come out with its own unique model, because what works in the other parts of the country may not really work out in this part of the country. So we need to come out with our own new model, especially in the wake of new schemes like Makkale Thedi Marutham, which is the Honorable Chief Minister's flagship scheme of delivering healthcare at the doorsteps. And this has a clear convergence with what is the future for cancer-based palliative and pain processes. So once again, I wish you all the very best, and thank AstraZeneca as well as Nellai Cancer Care for this early detection program, which I'm sure our staff, government staff also will benefit in large numbers. We will ensure that this is converged with the block and taluka level offices. Also, already we have done a ophthalmic screening process, especially for glaucoma and cataract, and we have had good success, especially looking at our own government officials who fall mostly under the bandwidth of the 50 to 60 age group. The average age of a government official is around 46.5. So on that note, I would see a lot of potential on screening our government staff alone in a big way, especially the sanitary care workers, local body officials, the municipal corporation, the revenue department. These are all large captive, and definitely our own the police department, which I'm sure will get in large numbers. We will extend all support possible to the initiative. Once again, thank you and all the best.
Thank you so much. Thank you so much. And you have always been people's, welfare-oriented officer, and we can always see a lot of positive action happening with public-private partnership. We will continue to do the best. And at this note, I also wanted to share here that we have been engaged in screening work for last 10 years. At an average, we used to reach out to 6,000 people in a year. But in last 2 months, because of your support, because of the government support, we are touching around 1,000 plus screening. That is only because of the kind of support we have been getting from the government. So in this project, we are going to create awareness among 30,000 people and also screen over 9,000 people. With this note, I would request Mr. Deepak Arora to formally share his experience with AstraZeneca and also share his in detail share about AstraZeneca's engagement in cancer care through Ganga Godavari project. Please, sir.
Thank you so much. First of all, on behalf of AstraZeneca, a warm welcome to everyone, and thanks Vishnu sir, Ram sir and Shankar sir for your esteemed presence and also giving us an opportunity to bring Ganga Godavari to Tirunelveli. A big thanks to Hari and the team who have been a big support in terms of taking the conceptualization of Ganga Godavari and the implementation which is happening in many other states and bringing to Tamil Nadu. So we're very happy to that. I'm doing this address on behalf of our country president, Mr. Baranitv Singh. Unfortunately, he could not attend due to some emergency, but I will try to do the justice and the passion which he has towards Ganga Godavari and try to present a bit of it. But he was the one who was the founder and initiator of Ganga Godavari, of women screening, women cancer screening all over the India. The word itself, the initiative itself from Ganga to Godavari was somewhere his brainchild. Just a little background on AstraZeneca. AstraZeneca, being a global science-led biopharmaceutical company, continues to push boundaries of science in search of solutions, mainly in prevention, treatment, and even cure in some of the world's most serious health challenges, including in respiratory, oncology, and cardiovascular, renal, metabolic. And now it has become a household name because of COVID-19, trying to push the boundary of science and making sure years or months delivery of getting a vaccine was there in 6 months' time to support mankind. So and it leads to much more responsibility because being a household name because of the COVID vaccine, that we make sure that we are towards our whole ambition towards solutions towards prevent, treatment, and even cure. But it does not it does not stop there. Our contribution to society extends beyond this to include a wider effort to benefit people and the planet. And we are working towards a future where everyone has access to healthcare and its solutions for prevention and treatment. In this regards, I think to support the initiatives of importance of communities in which we operate, we see a tailored program to rural needs. And Ganga Godavari Cancer Screening Program is one such example. I don't have to tell the August gathering here in terms of how cancer is one of the leading causes of mortality to this high incidence, but also the challenge is compounded by the situation of late detection, low awareness among the general population, and at any given time, India is estimated to see around 2.7 million cancer patients in the country, especially among women. Reported cancer incidence in India is estimated to increase 110% per 1 lakh population to 190 or 260 per 1 lakh population by 2025, which mirrors the incidence of China and some upper middle income countries like Brazil and Thailand. Ganga Godavari mission is to build a community behavior towards screening women for cervical, oral and breast cancer. Keeping the issue on the top, the initiative tends to create awareness, detect oral, breast and cervical cancer at early stages amongst women to specialized cancer screening camps. This initiative wishes to supplement Government of India's initiative Ayushman Bharat Health and Wellness Center program of early screening and diagnosis for oral, breast and cervical cancer in women aged over 30. We started this campaign or initiative in the year 2019 and partnered with set of organizations like Indian Cancer Society, government of the state government of UP and many others in 2 phases. We started with Kerala, Maharashtra, Tamil Nadu, Karnataka, where the overall program initiative was to look at more than 200 camps and screen around 10,000 women. We led also one of the programs with Tikri Village in association with Banaras University in Uttar Pradesh, adopted the complete village and not only did the awareness but also hand-holded the women in terms of creating trainer or coaches or in that village to create awareness among their peers and make sure that the community understands and tries to also look into, apart from screening, how to prevent gutka or tobacco use, which is key compounded the catalyst of oral cancer. The idea of this partnership of the organization is a strong understanding of what we've been doing with Ganga Godavari and also community targeted approach. We're very happy that we have a partnership today with the in Tamil Nadu. Our whole aspect is to around 80 camps with the Ganga Godavari program and at least benefit 6,000 plus beneficiaries who will register and be screened. All these positive cases will be in line with the local authorities, will be made sure that they get their appropriate treatment as they move forward. Just an example, 200 women which were screened in Tikri in 2 camps, out of which 10 early suspects will be pushed to Banaras University, and I am very happy to share that they are in their early stages and we can prevent second or progression of those cancer, and these women are back in terms of their health and also the awareness which is required for our women, and they are becoming our educators in that village. So the impact is just not screening. The impact can be much more wider and bigger by training and creating capacity and capability by the women itself as peer educators in those villages or in those communities. With this, a big thank you again, and we look forward for welcoming the partnership and looking forward for a very, very successful camp and screening initiative with the Ganga Godavari ahead.
Thank you so much, sir. Thank you so much. And as usual, this is a very unique program, and which is from Ganga to Godavari and extended to Tamraparni, because southern part of Tamil Nadu is very, very unique, and we have a very good conducive environment to do that. And as part of the preventive oncology and CAT and palliative care services, with the Adyar Cancer Institute support and now Tata Memorial Hospital support, technical guidance, we have been expanding our services, and this will really help us to screen patients in the early stages, which we will ensure. To share our example is, out of the 44,000 people who have been screened, we identified around 180 people in the early stages. Almost 78 of them are completely cured, and they are all under our follow-up services thanks to our team members. And AstraZeneca's CSR project will help us to expand our services along with the district administration, public health system, because we can expand the services in the primary health center. We already have piloted in Mukudal, one of our core project area. In Mukudal, Papakudi Panchayat alone, we are following up almost 21 patients. So this is one area which we want to share. And we we also have representatives from the registered, retired pensioners association. Over 40,000 people are engaged in that. They have been collaborating with us, and they have been utilizing the best of the services from us. And Mr. Nellai sir is over here. Ninga sila vaarthagal pesalama sir. Oru sila vaarthagal. Sir, inga vandavilla.
இல்ல நீங்க அங்க கேட்காது
நிகழ்ச்சிக்கு என்னை கலந்து கொள்வதற்கு ராம்குமார் தெரிவித்திலே இங்கே நான் வந்து மாவட்ட ஆட்சியர்கள் பல்வேறு பணிகள் செய்துள்ளால் சில கேன்சர் இது பண்ணியிருக்காங்க. அது மீது அவருக்கும் நிஜமாக ஓய்வு செய்திருக்காங்க. நன்றி தெரிவித்துள்ளேன். என்னுடைய பென்ஷன் இருமுறை நெல்லை கேன்சர் உதவுள்ளவர்கள் சார்பாக ராம்குமார் அபிராமர்களும் அங்கே வருகை விளக்கமான விஷயங்கள் தெரிவித்தார்கள். அதுபோல் மகளிர் தினத்தன்று கூட டாக்டர் அவர்கள் வந்து அந்த தப்பாக எங்கள் மக்கள் மத்தியிலும் இது ஒரு பெரிய விழிப்புணர்வு ஏற்படுத்தியிருக்கின்றார்கள். அதை தொடர்ந்து எங்கள் திருநெல்வேலி மாவட்டம் முழுமையாக இதை நாங்கள் பண்ணுவதற்கான ஏற்பாடு சார்பு சொல்லியிருக்கோம். இன்னைக்கு எங்களுடைய மகளிர் வரத்தில் இன்னும் நாங்கள் சுற்றி எங்கள் மீட்டிங் போனதுனால நான் சரியாக கம்யூனிகேஷன் பண்ண முடியல. அடுத்த முறை நான் வந்து சார்பாக அந்த முறை எங்கள் பயனுள்ள இதையும் நாங்கள் சிறப்பாக செஞ்சோம். அதுக்கு எங்களுக்கு உதவி செஞ்சிருந்த அந்த நெல்லை கேன்சர் சென்டர் குறிப்பாக அந்த ராம்குமார் அவர்களுக்கும்
there are over 40,000 people. Majority of cancer patients who are being identified of late as above 65, 60 and above, and this is one of the core areas where we need to. And the main challenge is caregivers. And when we have challenges with the caregiver, our team facilitates and psychosocial support, and we also provide a lot of other support system, especially for educational scholarship, and we have support. And government, Tamil Nadu government and central government's integrated chief minister's health insurance scheme is a major boon. For example, for a PET scan, for all our for all PET scan, including PET scan and all services, it is provided free of cost. It's a major boon which is provided by all our governments, and this will go a long way to ensure the best of care and support of our cancer patients. And from AstraZeneca team, Mr. Shiva, you can share.
Yeah, Shiva, it would be good if from your perspective. Shiva is our center head, JIDC in Chennai. Shiva, I would like to call you.
Yeah, excited. Thank you for the opportunity. Very good afternoon, good evening to everyone that's gathered here. It is fantastic to see how the governments, the medical college, and partners such as ourselves, the volunteers have all come together, as well as our partners, to do something as noble as this. Really, Tamil Nadu is a very important state for us. I head the Global Innovation and Technology Center located in Chennai, and we have about 2,500 people based here, and we are serving every part of AstraZeneca worldwide. And all of these employees, many of them come from all parts of Tamil Nadu, including the Nellai district. So this initiative is really in line with our goal of helping the communities that we belong to and our employees belong to. So it's really great to see the Ganga Godavari program now coming all the way up to Thamrabarani. Nellai is a very special place for me. My ancestral village, Gopala Sankaram, my father and mother are from Nellai district. So really great to see this being extended to Nellai. AstraZeneca, as Deepak described, in oncology and cancer care is one of our largest, is the largest area of health that we focus in, currently that we focus in around the world. Our bold ambition is to eliminate cancer as a cause of death in the decades to come. And early detection is such a very important thing in here, to cure and to stop the progression of disease. So it is fantastic to see the bold ambition that you have set out, that Mr. Namaria, conveying just now to reach 9,000 beneficiaries. That is really bold and really great ambition, and we are looking forward to partner in every way with you on this great mission. So I just would want to wish everyone great success in this, and thanks again for holding hands and collaborating on this noble mission. Thank you.
Thank you so much, sir. Thank you so much. And we will definitely, and great to know that you have your roots from Gopal Samudram, which really makes a lot of difference. And whatever we do, this is because of our support from our trustees and the government and all the leadership over here. And without their support, we cannot really take it forward. And with this short, so this is a great opportunity for all of us to collaborate and engage. And over here, since we have some time, I would request one of our senior staff to share her experience. Parvati Manga. She's our senior nurse. And she is working with us for last 11 years. And she has been working from the day one. I would request, I request her to speak.
என்னோட பேர் பார்வதி. நான் இங்கே ஒரு 10 இயர்ஸாக ஒர்க் பண்ணிகிட்ருக்கிறேன். ஸோ என்னென்னா, ஆரம்பத்தில் நம்மளுக்கு வந்து நிறைய ஒரு சின்ன கஷ்டங்கள் நிறையா இருந்தது. தேவையான எக்யூப்மெண்ட்ஸ் அந்த மாதிரி வசதிகள் வந்து நம்மளுக்கு கம்மியாக இருந்தது. சொந்தமாக இருக்கிறதுக்கு ஒரு இடம் இல்லாமல் அந்த மாதிரி நிறைய சின்ன பிரச்சனைகள்லாம் அதிகமாக இருந்தது. ஸோ அப்போ இருந்ததை பார்க்கும்போது இப்போ இருக்கிறது வந்து எனக்கு ரொம்ப சந்தோஷமாக இருக்குது. இன்னும் கொஞ்சம் ஒர்க் பண்ணுறதுக்கு கொஞ்சம் ஆர்வமாகவும் இருக்குது. ஏன்னா அப்போ வந்து இந்த வசதிகள் எங்களுக்கு இல்லை. இப்போ நான் அழகாக ஒரு வெஹிக்கிள்லாம் நம்மளுக்கு இருக்குது. அப்போ ஒரு கேம்ப் போகணுன்னா நம்ம இன்னொரு ஆட்டோவோ இல்லை வேறு வேன் அந்த மாதிரி ஏதாவது ஒன்று தான் எடுத்துகிட்டு போகணும். இப்போ நம்மளுக்கு சொந்தமாக ஒரு வேன் இருக்குது, இருக்கிறதுக்கு நல்ல ஒரு பிளேஸ் இருக்குது. ஸோ இந்த மாதிரி வசதிகள் வந்து நம்மளுக்கு அதிகமாக இருக்கும்போது பேஷண்ட்டுக்கும் அதிகமாக நம்மளுக்கு கேர் கொடுக்க சப்போர்ட் பண்ணுறதுக்கு நம்மளுக்கு இன்னும் கொஞ்சம் வசதியாக இருக்குது. ஸோ அது எங்களுக்கு நல்லா ஹாப்பியாக இருக்குது. அது மாதிரி பார்த்தீங்கன்னா பாலியேட்டிவ் கேரில் வந்து பார்த்தீங்கன்னா ஒவ்வொரு டிஃப்ரெண்ட்டாக ஒவ்வொரு பேஷண்ட்டையும் பார்க்கும்போது ஒவ்வொரு டிஃப்ரெண்ட் டைப் ஆஃப் எக்ஸ்பீரியன்ஸ் எங்களுக்கே கிடைக்கும். ஏன்னா ஒவ்வொரு பேஷண்ட்டோடைய தேவையும் ஒவ்வொரு மாதிரி இருக்கும். சிலவங்களை பார்த்தீங்கன்னா அவங்க ஃபேமிலி சப்போர்ட் இல்லாததுனால ட்ரீட்மெண்ட் போகாமல் இருப்பாங்க. சிலவங்க பார்த்தீங்கன்னா அவங்களுக்கு ஃபினான்சியல் சப்போர்ட் இல்லாததுனால ட்ரீட்மெண்ட் போக முடியாமல் இருப்பாங்க. சிலவங்களுக்கு ரெண்டுமே இருக்கும், ஆனால் கரெக்டாக எங்கே போகிறது என்ன ட்ரீட்மெண்ட் எடுக்கிறதுன்றது அவங்களுக்கு தெரியாமல் இருக்கும். ஸோ அந்த மாதிரி ஒரு டைமில் நம்ம போய் அவங்கள கரெக்டாக அப்ரோச் பண்ணும்போது அவங்க நம்மளுக்கு நல்லா சப்போர்ட் பண்ணும்போது நம்மளுக்கு வந்து அவங்களோட தேவையை பூர்த்தி செய்கிறதுக்கு நம்மளுக்கு வந்து வசதியாக இருக்குது. ஏன்னா இப்போ நம்மளுக்கு ஒரு 2 வீலர் இருக்குது, ஒரு வெஹிக்கிள் இருக்குது. ரொம்ப ரூரல் ஏரியாவில் இருக்கிற பாலியேட்டிவ் பேஷண்ட்னா நம்ம 2 வீலர்லேயே போய் அவங்கள போய் பார்த்துடலாம். அவங்களுக்கு என்ன தேவை, அவங்களோட நீடு என்னன்னு நம்ம தெரிஞ்சுட்டு, ஒரு வேளை ட்ரெஸ்ஸிங் தேவையா, இல்லை ரைல்ஸ் டியூப் அவங்க சாப்பிட முடியாமல் இருக்காங்களா, ரைல்ஸ் டியூப் போடணுமா, இல்லை பெட் ரிடென்ட்டாக இருக்காங்க, வேறு ஏதாவது ஊண்டு இருந்தால் ட்ரெஸ்ஸிங் பண்ணுறது, பெட் பாத் பண்ணுறது, ஸோ கெத்திட்ரைஸ் பண்ணுறது எல்லாமே வந்து நம்ம இப்போ அவங்களுக்கு எல்லா ப்ரொசீஜரும் நம்ம அவங்களுக்கு பண்ணிகிட்ருக்குறோம். சிலவங்களுக்கு பார்த்திங்கன்னா அங்கேருந்து நம்மளுக்கு வர முடியாமல் இருப்பாங்க, ஃபினான்ஷியல் சப்போர்ட் இல்லாமல் நம்மக்கிட்ட வர முடியாமல் இருப்பாங்க. அவங்களுக்கு நம்ம வந்து ட்ராவல் அலவன்ஸ் கூட கொடுத்து நம்ம வந்து அவங்கள இன்னமும் நம்ம வந்து அவங்கள ஃபாலோஅப்பில் வச்சுட்ருக்குறோம். தேங்க்யூ சார்.
Thank you so much, Parvati. Actually, she was sharing that there were resources, there were issues with relation to resources, patients affordability, and there were also issues with relation to accessibility to to the hospital, and many of the patients, they used to get dropped out. So to address this, we started the intensive action of community-based, home-based care services along with palliative care, which has ensured the best of the support to the patients. And most importantly, we also provide nutritional support to the patients, which has ensured better nutritional status, micro and macro level, and it has really made a lot of difference. So with this note, I would also request our founder trustee, Mr. Shankar Mahadevan sir, to share his experience, and we'll get into the vote of thanks. Thank you so much. Looking forward to you, sir.
Good evening, everybody. Am I audible?
Yes, sir.
Good evening, everybody. This mission started in the year 2011. The idea of Dr. Shanta coming, Dr. Shanta late Dr. Shanta chairman of Parayar Cancer School. She once convened a meeting in which, if we find the language that still 60-70% people are coming in rural areas in third, fourth stages. So we have to extend our awareness in the rural areas. So at that time we took a decision to take this to Tirunelveli. So that's why we started this cancer prevention center in Tirunelveli. Now with the support of the government and our very good team, they are all highly dedicated. What we are doing is because of the dedication of the team and the support of targets. I thank all of you, and this mission will continue, and as per our collector's vision, we will work together and see that this Tirunelveli will become a cancer-free area, and we will extend all our services to the poor cancer patients. Thank you.
Thank you so much, sir. Thank you so much for all the guidance and support. And with this, we would like to have a formal vote of thanks. And if any other feedback, sir, any other feedback, and we always collaborate with our government. This project will always be a public-private partnership, wherein we will extend maximum leverage maximum support, and we will extend mutually work together at all levels. And any audience from any participant from the AstraZeneca, you want to share your feedbacks? Hari?
I have already shared. That's why I'm part of this. Having over. Okay, so this is Gaba. So it's very happy to see you, sir. Both the public and private partnerships are happening, and then taking the healthcare to the next level. So probably we will be happy to see how it is happening. Probably we will visit some more time. Okay, because it's a very short time. We are able to make participants during this event. So for sure we will be there to see how the progress is going, and we will be part of that. The work, which is the great work which we are doing. Thank you everyone.
Thank you so much, sir. And now over here, we also wanted to thank the special Tahsildar, Mr. Selvam, who is over here, who has been supporting us. And I would also like to thank Mr. Abdul sir, who has been very supportive. He's the in charge for extension education in Collectorate. He has been supporting us. So with this note, we will have the formal vote of thanks by our project officer, Mr.
இந்த இனிய நிகழ்வை தலைமையேற்று அருமையாக நடத்தி தந்த மாவட்ட ஆட்சித்தலைவர் அவர்களுக்கும் அதற்கு உறுதுணையாக இருந்த அனைத்து அரசு அலுவலர் அவர்களுக்கும் எங்களுடைய உதவுள்ளங்கள் நெல்லை கேன்சர் கேர் சென்டர் ஃபவுண்டர் மற்றும் சேர்மன் திரு சங்கர் மகாதேவன் அவர்களுக்கும் மற்றும் அஸ்ட்ரஜெனிகா திரு தீபக் அரோரா அவர்களுக்கும் ஹரி அவர்களுக்கும் திரு சிவா அவர்களுக்கும் மற்றும் ஏனைய எங்களுடைய பணியாற்றக்கூடிய அனைத்து அலுவலருக்கும் மற்றும் எங்களுடைய நெல்லை கேன்சர் கேர் சென்டர் இயக்குனர் திரு ராம்குமார் சார் அவர்களுக்கும் எங்களோட பணியாற்றக்கூடிய அனைத்து நல்ல இதயங்களுக்கும் இது கலந்து கொண்டு தங்களுடைய பரிமாணத்தை வெளிப்படுத்திய திருமதி அருணாச்சலம் அவர்களுக்கும் அடுத்து ஓய்வு பெற்ற சங்கத்தின் தலைவர் அவர்களுக்கும் எங்கள் நெல்லை கேன்சர் கேர் சென்டர் மற்றும் உதவுள்ளங்கள் சார்பாகவும் மாவட்ட நிர்வாகத்தின் சார்பாகவும் மாவட்ட ஆட்சித்தலைவர் மற்றும் அரசு அலுவலர்கள் அனைத்து உள்ளங்களின் சார்பாகவும் நன்றியும் வணக்கத்தை தெரிவித்துக் கொள்கிறேன். மனம் மகிழ்கிறேன். நன்றி, வணக்கம்.
Thank you so much. Thank you. And with this note, we all can say we will continue to do the best, and we will do the best. Thank you so much, everyone, and let us do the best of our services. Let us give a big round of applause to everyone. And Team AstraZeneca, we are always looking forward to your continuous. Thank you so much, everyone. Thank you.
Thank you, sir.
Thank you so much.
Thank you, everyone.
Thank you.
Thank you. Thank you.
Thank you, sir. Thank you.
Nandri sir, Kumar Nandri, thank you sir. Sirpa Nandri,
சார் சார் ராம்குமார் சார் கட் பண்ணிடலாம். லைவ் கட் பண்ணிடலாம். லைவ் கட் பண்ணிடலாம்.